হ্যাঁ, আমার শোনা যাচ্ছে তো? বলছিলাম আমার তো এইখানকার ভিডিওটা ভালো না, আমি প্যারালালি একবার ট্রাই করছি আরেকটা আইডি থেকে লগ ইন করতে করে এখানে প্রেজেন্টেশনটা করব। আচ্ছা, স্ক্রিন শেয়ারিংটা একটু আমাকে অপ্ট করে দে, মানে আমার দুটো আইডিতেই আমাকে কো-হোস্ট করে দে। হ্যাঁ,
ঠিক আছে।
अच्छा, पार्टिसिपेंट्स का नाम मतलब जिनको एंटर करने देना है वो एक बार बता दो क्या?
हम देते हैं, हाँ हम दे देते हैं।
स्वप्ना सरांगी अभी तक कोई एंटर नहीं किया है।
नहीं, कोई एंटर करेगा ना, अभी करेगा ये। लोगों को पता है ना 3 बजे होने वाला है।
लाइव हो गया यूट्यूब पे।
सर इससे एडमिट करो,
को-होस्ट हो।
हाँ को-होस्ट हो। अभी
এই দাঁড়া, ফিডব্যাকটাকে সিলেক্ট করি। ফিডব্যাক কারেক্টেড হয়েছে or is it still taking the feedback?
নিকুচের আসছে তোমার ভিডিও। হ্যাঁ স্যার এসছে, ঠিক আছে।
সো এই ডিভাইসটা থেকে ধর আমার কথাও শোনা যাচ্ছে আর আমাকে দেখাও যাচ্ছে, আর আমি অন্য ডিভাইসটা থেকে জাস্ট স্ক্রিন শেয়ারিং করছি, করে সেখান থেকে আমি পাওয়ার পয়েন্টটা শেয়ার করছি।
ওকে স্যার। এটা কে
स्वप्ना की एडमिट করব কেউ স্বপ্না বলে আছে?
हाँ, स्वप्ना सरांगी।
ना अभी एडमिट नहीं करना प्लीज।
ओके,
जब बोलेंगे उसके बाद प्लीज। ओके, वेटिंग रूम में रहने दो।
আচ্ছা, আমি কি একবার স্ক্রিন শেয়ার করে দেখে নেব?
হ্যাঁ স্যার, এখন দেখে নি, এখন কোনো পার্টিসিপেন্ট নেই। হ্যাঁ স্যার।
তো তোদের কি কোয়েশ্চেনগুলো একবার দেখিয়ে নেবো নাকি টাইম হবে না?
কোশ্চেন গুলো দেখাতে পারেন, টাইম তো আছে। পার্টিসিপেন্ট আছে কি কোনো?
না
স্যার, যারা রাখছিস তাদের তো বলেছি 3টে রাউন্ড হচ্ছে, তো 3টে রাউন্ডের ফার্স্ট রাউন্ডে মার্কস হচ্ছে +10 or 0, there is no passing. সেকেন্ড রাউন্ডে 5+5+5, প্রত্যেকটা কোয়েশ্চেনের 3 পার্টস and there is no negative marking, no passing. আর ফাইনাল রাউন্ডটাতে 3 part question, it's 10, 20, 30, কিন্তু there is negative marking. ফুল উত্তর দিলে পরে ইকুয়াল অ্যামাউন্ট মাইনাস হবে।
ওকে,
সব ঠিকঠাকই আসছে। ওকে
স্যার, রাউন্ড 1 একটাই কোয়েশ্চেন 10 মার্কসের?
হ্যাঁ, রাউন্ড 1-এ একটাই কোয়েশ্চেন 10 মার্কসের।
আর রাউন্ড 2-তে হচ্ছে 5টা কোয়েশ্চেন?
রাউন্ড 2-তেও তোর পার হেড 3টে করে কোয়েশ্চেন, 5 5 5 করে নম্বর।
আচ্ছা, আর রাউন্ড 3-তে হচ্ছে 30 20 10?
30 20 10।
আচ্ছা, থ্যাংক ইউ স্যার।
সবাই একবার এসে যাক, তবে কি আগে সবাই এসে যাক ওয়েটিং রুমে, তবে ঢোকাবো।
পার্টি
वन क्वेश्चन
সবাইকে ঢোকাতে স্টার্ট করে দেব।
ওকে ঢোকাতে, তবে স্যার তবে হ্যাঁ তবে
না দাঁড়া আরেকটা জিনিস।
ঠিক আছে, দাঁড়া
আরেকটা জিনিস। আর স্যার
কনফার্ম করেন না সবকিছু।
শেষে মানে যখন একবার কুইজটা হয়ে যাবে, তো আমরা আপনাকে একটা ওই ক্লোজিং রিমার্ক দিতে বলবো অ্যাবাউট দিস, আর সেই সময় আমরা বেসিক্যালি মার্কসটা ট্যাবুলেট করে নেব এখানে, এন্ড দেন মেবি আপনি রেজাল্টগুলো ডিক্লেয়ার করবেন, মানে ইয়াশ বলে দেবে যে আপনি ডিক্লেয়ার করবেন রেজাল্টসগুলো।
রেজাল্ট এখনই করবে তো?
হ্যাঁ, এখনই করে দেবো, আর এই শীটেই আমরা করে দেবো।
अच्छा दी उसके बाद प्राइस के बारे में उसके बाद में बताना है ना?
हाँ प्राइस को ग्रुप में बताएंगे
नहीं
price को अभी नहीं।
कि मतलब that 6 month of Marrow subscription and everything.
ওটা
हाँ वो
শুরুতে
सब तो শুরুতে কেন
शुरू में
শুরুতে কেন
না
শুরুতে তো
লাইক
খালি সাড়ে
টপ 3 ফাইনালিস্ট আসবে তাদের এটা প্রাইস দেন স্টার্ট
ओके
অ্যাকচুয়ালি তোর যেটা
সাড়ে হ্যাঁ
अच्छा ठीक है
হ্যাঁ
যেটা
না
শুরু।
বললেও চলবে যেটা বলতে
হ্যাঁ,
পারি
ঠিক
एंड मैरो का नाम मेंशन करना है
चलेगा
চলেगा
बिकॉज इट्स लाइव ना इसलिए पूछ रहा था।
हाँ हाँ कुछ नहीं होगा मेरे को नाम मेंशन करने से अच्छा होगा
ওকে
তো কি করি তবে সবাই ঢুকে সবাই ওয়েটিং রুমে আছে
হ্যাঁ ঠিক আছে এবার স্টার্ট করি কিছু না
অ্যাডমিট করি
হ্যাঁ
यस भैया रेडी
यस
ओके ওকে স্যার স্যার ইংলিশ বেশি ইউজ করবেন ওকে
ওকে ওকে ঠিক আছে
সবাই আছে
সবাইকে ঢুকিয়ে দিয়েছে
ওকে
so everyone has entered the room
please open your video
shall I start okay
everyone
Good
can hear
everyone can hear right okay a very good afternoon to everyone present over here. We welcome you all to the Paraclinical quiz finale organized by SAMSACON. The quiz master for the day is Dr. Tirthankar Guha sir. Sir is a very renowned person and quite popular among medical students. He is currently the head of department of the physiology department at KPC Medical College and Hospital. He has conducted several quizzes and debates before, and last year also in SAMSACON we had sir for our pre and paraclinical quiz. His interesting and fun way to conduct quiz help us to gain knowledge about the subject as well. We will be, the OC of the SAMSACON will be assisting sir in the finale. In the finale, we have the 6 contestants. Their names are Swapna Sarangi, Tamal Adhikari, Ayan Agarwal, Sarvanan S, Subhaditya Basu, and Tanisha Sanganeria. We congratulate you all and wish you all the best for today's quiz. Now I pass it on to sir, who will be explaining further about the rule and marking scheme for the finale. Sir, thank you.
Thank you, Yash, and congratulations to all those who have qualified for the final rounds. In the final rounds, we'll be having a quiz of 3 rounds. So I'll explain the rules one by one as we go. So the first round is a pretty straightforward round. In the first round, I'll give you one question per team. So each team gets one question, and each question comes with a statement of the question and an image that follows it. The question is pretty much based on the image. So it can be about the diagnosis, about the treatment, or about the condition. So you have to know what has been asked there, and then that is the question. For each of these questions, you will be getting 40 seconds of time. And within 40 seconds, you have to answer. The answer must be clearly spoken out to me. And for every correct answer, I think someone's phone is on, right? For every correct answer, you will get plus 10. For every wrong answer, you get 0. So there is no negative marking. Also in this round, the questions do not pass over to anyone. So if you cannot answer a question, either others can volunteer to answer, but they will not get any points for that, or the quizmaster will disclose the answer. So that is it. That is pretty much it. So let me know when we are ready to go. Yash, can we start? Okay.
I have added the name of the participants in the sheet, so we can start it from there.
And I think is the sheet is also getting screen shared, right?
No, so we'll only be screen sharing it after each round, like round 1.
Okay, so someone please take charge of that. So you keep the scores. I'll also be mentioning the score after each question. So you take down the scores and please announce the score sheet after each round. So we start with the first round. So I hope that The screen is visible to everyone where it's written round 1 warm-up round. Participants, I hope all of you can see. Also, it will be good if the participants can check their audio once. So can I speak to the participants one by one? How are they sequentially arranged? So I can see all of you. Who is participant number 1 here?
Swapna Sarangi.
Okay.
Yes, sir.
So remember that you are team number 1. So
Okay, sir.
So the first participant is Swapna Sarangi. Second is Tamal Adhikari. Third is Mr. Ayan Agarwal. Fourth is Sarvanan S. Fifth is Subhaditya Basu. And sixth is Tanisha Sangaleria. Please, participants, remember the sequence.
Okay, fine. So we have our very first question. My first question goes to participant number 1. So as I explained to you, the rule of this particular round, in this round we'll be essentially giving you one question, and one question comes with one image. Read the question. Your time will start after I end reading the question, and then you will get 40 seconds to answer. This is the first question. So this is the colonoscopy image and biopsy report of a patient with chronic diarrhea. Diagnose the underlying condition. So the upper image is the colonoscopy image, lower image is the biopsy. Your time has started, Swapna.
Yes, sir. Yes, sir. Sir, ulcerative colitis.
Okay, that is your final answer?
Yes, sir.
Okay. So, Swapna, this answer is not correct. So you get 0 for this, but it's well tried. Now can anyone from the participant, would they like to volunteer? There will be no point for this though. If someone would like to volunteer, they can unmute or raise hand and give the answer. Since no one is giving the answer, so maybe I should reveal the answer. You see, it was not a very difficult question. This is the colon. This is the lumen of the colon. And you can see round ulcers here. So whatever ulcer we are talking of are deep ulcers. Now, ulcerative colitis typically is a diffuse serpiginous ulcer. It is never localized like a point. It is throughout the mucosa. It's not like that. These are focal ulcers present here and there only. And today, you've seen the histology image that apart from inflammatory cells, there are some peculiar round cells. These round cells have a dark nucleus and a granular cytoplasm. So this was a very simple case of intestinal amoebiasis. And these are the entamoeba histolytica. So these are flask-shaped ulcers of amoebiasis. And what we see here are individual cells of entamoeba histolytica. So the diagnosis was intestinal amoebiasis. Fine. So we'll move on to participant number 2. Participant number 2, this is your direct question.
Amal Adhikari, please be ready.
A 17-year-old girl presented with fever, pallor, fatigue, weight loss, infections, and bleeding. The para-iodic acid sheaf stain of her blood film looked like this. This is the blood film, but not stained by Leishman stain, stained by PAS stain. What is the diagnosis? Your time has started. Make sure that you have unmuted yourself. 17-year-old girl presented with fever, pallor, fatigue, weight loss, infection, bleeding. This is
Sir,
the
time is up.
Time is up. So any guess, anyone, including the participant, but you will not get any points for this.
So Cherry Gachi.
This
Swapna,
is,
you can.
yes,
No, you
Cherry Gachi. Sir, intracytoplasmic granules,
no,
infections.
Sir,
yes,
sir, Whipple's disease.
no.
So AML M6.
Very good. This is AML-M6. See, a 17 age is like between 15 to 25, which is the age of acute myeloid leukemia. Pallor, fatigue, weight loss, infection, bleeding are all common features of acute leukemia. Now look at the peripheral blood picture image. In acute leukemia, lymphoid leukemia are PAS positive and erythroleukemia are PAS positive. No other leukemia are PAS positive. So these are the erythroblasts showing PAS positive granules. So this is erythroleukemia or the AML-M6. Okay, it was nice, right? Next, we move on to the third question. So who is our third participant? Ayun.
Yes, sir.
Okay, so this is your question. A patient had a lung tumor operated by the thoracic surgery department. The biopsy of the tumor or the specimen looked like this. Give the specific name of this tumor. What is this tumor? I mean, lung tumor is already said in the question, so that is not the diagnosis. I need a more specific diagnosis.
Sir, bronchoalveolar carcinoma or adenocarcinoma in situ.
You have given me two diagnoses. You have to choose one diagnosis.
Sir, bronchoalveolar carcinoma.
So that's final?
Yes, sir.
Okay, wonderful. This is bronchiolo-alveolar carcinoma, a very specific type of adenocarcinoma where the classical description is, you see, the malignant cells crawl on the surface of the alveoli. They walk on the surface of the alveoli as if they are holding hands and forming chains of cells all along the surface. This appearance is the classical appearance of the specialized adenocarcinoma known as bronchiolo-alveolar carcinoma. So you get, Ayun gets plus 10 for this. Ayun, you get plus 10. We move on to the fourth participant. Who is our fourth participant?
Saravan.
Okay. This is your question. A patient presented with a hereditary disorder that causes weight gain, fever, diarrhea, bloody stool, and vomiting. His urine looks like this under the microscope. These crystals are insoluble in alcohol, ether, or acetone. What is the metabolic condition that we are talking about? Make sure that you're unmuted.
Whether it's essential fructosuria, fructose crystals are.
So that's your final answer?
Yes. Yes, sir.
Okay. So unfortunately, the answer is wrong. You came very close to this. Fructose crystals are usually not like this. I know where you made the mistake. Fructose, when it forms osazone crystal, the osazones look like this. But I never said that osazone test was done. It was a simple urine test. So crystalluria or crystal formation typically does not happen with sugars because they are water soluble. But they do form osazone when you treat them with the azo agent. This is the classical broom-shaped or needle-shaped crystal of tyrosine. And we are dealing here with hereditary tyrosinemia. They are very closely looking because the osazone of fructose does look very similar. That is where I think you got confused. Okay, so this is a wrong answer. You get 0 for this. So who is our fifth participant? It's a straight question to the fifth participant.
Our fifth participant is Ms. Subhaditya.
Okay, Shubhaditya, this is your question. A patient presented with hypertensive emergency and chest pain. Follow-up biopsy from the abdomen shows a histology like this. What is your diagnosis? A patient presented with hypertensive emergency and chest pain. Biopsy from the abdomen shows this. And what is your diagnosis?
Time is over.
Time is up. Okay, so would anyone like to try, including you, Shubhaditya, or anyone else? There's no harm in trying. Anyone? Any of the participants would like to try? One thing
Whether
I'm
it's
telling you, see, I know that you are from the second and the third year, so none of the questions are difficult. They're all from your syllabus.
Sir, carcinoid.
You're very close to the diagnosis. You are very close. But will carcinoid tumor cause hypertensive emergency or hypotension?
pheochromocytoma cell balance pattern.
So you are right in thinking that a densely populated blue cell mass will indicate a neuroendocrine tumor. So now the question comes, which neuroendocrine tumor is in the abdomen and it causes hypertension? A catecholamiin secreting neuroendocrine tumor. To make things more common, you see below what you can see here is the histology of the adrenal gland. So it's half adrenal and half tumor. So you did have a pheochromocytoma, and this was a pheochromocytoma with a secretion status. So there was hypertensive emergency and chest pain. Okay, fine. So who is our sixth participant?
Sir.
Miss Tanisha Sanganeria.
Okay, so this is your question, Tanisha. This is the barium X-ray of a 45-year-old man presenting with recurrent episodes of acute abdomen. I have highlighted the part where some finding is there. You identify the etiology, what is causing the recurrent episode of acute abdomen.
Sir, is it the string sign which is associated with?
You cannot ask me. You can suggest that your answer is string sign, then I'll take that answer and log the answer. But I cannot say whether it's correct or not.
Ischemic colitis, I would like to go for that.
Okay. So that is your final answer?
Yes, sir.
Okay. So again, this answer is wrong. And who can give me or guess the correct answer? One thing I told you in the very beginning, see, I have set questions from your syllabus. Maybe the presentations are different, but the topics are all taken mostly from the last 10 years of your examination. So I did not choose uncommon topics for the questions.
Sir, is it Crohn's?
No, it's not Crohn's. I know why Crohn's, because you think this is the stricture showing the string sign, but no, it's not Crohn's.
Sir, chronic mesenteric ischemia.
No, it's not chronic mesenteric ischemia. What does it look like? Can you describe it just in literal terms in English? Is it not looking like two parallel lines lying side by side? These are the male and female Ascaris worms showing tram track appearance. So this is ascariasis, which is so common to cause surgical complication. And we know that in straight X-ray or in barium X-ray, it often shows a tram track appearance. So this is the tram track appearance shown by Ascaris lumbricoides. So this was ascariasis causing some kind of surgical complication. Okay, so the etiology is Ascaris lumbricoides. So at the end of the first round, how do our scores look? Can you please read out the score?
Can we have the scores, please?
Wonderful. It's a very tough competition then. Oyon, congratulations. You have opened your account with 10 points and the others are yet to open their accounts. I hope in the next round, all of you will score very high. Thank you so much for showing. So we'll get back to the quiz, the second round of the quiz. Now, before we start, I'll discuss with you the rules for the second round of the quiz. So what are the rules for the second round of this quiz? In this second round of the quiz, you will see that the questions typically come in 3 parts. The name of this round is Guess Who, but it's actually not about who, it's actually about what. So every question is a disease or a drug or a toxin talking to you in conversation. So just giving you an example, giving you a crude example of how the questions are going to be. Suppose there is a drug who is telling that I am a drug who is antipyretic and anti-inflammatory in nature. From there, you can make a guess. Suppose you say aspirin. The next clue that they give is, I am not very much prone to cause gastritis. However, I may cause hepatotoxicity. At this point, you might change your answer and say, no, it's paracetamol. So in this way, you guess the drug or the disease or the toxin or the etiological agent in 4 steps. In 3 steps. Each of the steps, the earlier you guess the answer right, the more marks you get. But you have to stick to the answer till the end. So if you give the right answer in the first go, you get 15. If you guess the right answer in the second go, you get 20. If you guess the right answer in the last go, then you get 10. And if you cannot guess the answer, you get 0. There is no negative marking to encourage answering, so that you don't stop answering from the fear of getting negative marks. So there is no negative marking. I'll ask all of you to say something at the end of each round, because saying doesn't score you negatively here. Also, every round here will be of 30 seconds. So every small question, every part of the question is 30 seconds each. So I hope the rules are clear to everyone. So here we go.
Sir,
now in this round, yes.
Excuse me, sir.
Yes.
Sir, like if we say answer once, can we change that during the total time?
Yes, of course, of course. In the 30 seconds of time, you can change as many time you want, but I'll take only the last answer before the buzzer goes out or before the organizers say time up. So I'll always take the last answer. That is it. In between, you can change it as many times as you want. Okay, and there is no negative marking, but only the last answer of every round will be taken. And you can also go back to the previous answer after changing. That is totally up to you. But you will always be given the point based on when you last mentioned it correctly, based on that. So let's see. Let us start. This time, we go in the opposite direction maybe.
Sir?
Yes. Yes.
Sir, can you please tell one more the time? What will be the time of each question?
30 seconds for every part. Suppose, so every person will have 1.5 minutes, but that's divided into 3 30-second slots.
Okay, sir.
Okay.
Okay, so in this in the round 2, we'll be going in a reverse manner. So our first contestant is Miss Tanisha Sanganeria for this round.
Yeah. So, Tanisha, this is your question. I am the first antibiotic to be used against tuberculosis. Your time starts now.
For isoniazid.
So, shall I move on to the second clue and check if it is correct?
Yes, sir.
Okay, your second clue. My discoverer received Nobel Prize in Physiology or Medicine in 1952. Will you stick to your answer or you want to change your answer?
Sir, I'll stick to it.
Okay, so your answer is isoniazid. The third clue and the final, so you get to decide whether you stick to it or not. I was isolated from a microbe discovered on New Jersey soil. Subsequently, the microbe was nominated as the official New Jersey state microbe.
Yes. Sir, isoniazid.
Okay, we'll stick to isoniazid. Fine. So now comes the time for revealing the answer. So shall I lock this answer?
Yes, sir.
Okay. Now, unfortunately, the answer is wrong again. So there is no problem. You get 0 for this. There is no negative marking. Now, there is no passing over this question as well, because others people will be getting more time here. So, but they can volunteer to answer if they wish. Is there anyone who has a good guess for what drug we are talking about? You don't get any points though.
The rifampicin.
Anything else? It is streptomycin. And the official New Jersey microbe is Streptomyces griseus. And one important clue was that it is not isoniazid, is it is an antibiotic. So it should be obtained from a microbe. It is not just an antimicrobial agent. Okay, fine. So who is our fifth participant? Fifth contestant was?
Our fifth contestant is Subhaditya Basu. Mr. Subhaditya Basu.
Subhaditya, this is your question. I am an autoimmune disease discovered by a renowned pathologist from Vanderbilt University in 1919 and was later named in his honor. Means I was named in honor of my founder or my discoverer. There is no negative marking, so you can always make a guess within 30 seconds.
Time is over.
Okay, time is over. We'll go to the next clue. I am more common in males than females. I am also less common in black than white, but I am more common in the Maori people of New Zealand. The disease is a rare disease, but it is relatively commonly found in the Maori people of New Zealand.
I guess Mr. Subhaditya has some technical issues. We can't hear his voice.
I also think so. The audio is not working. So you can chat the answer privately also. That's not a problem.
Yes,
You can
Mr.
type the answer privately. You can put the question on the board.
You can send the message directly to sir. Please check you have unmuted yourself.
Okay, Shubhaditya has given an answer here. Shubhaditya has written good pasture syndrome. So would you like to stick to this answer? I guess yes, that's why you wrote. So here comes the third clue, and you check whether you want to stay with your answer or you want to change your answer. I produce nephritic syndrome with nephrotic range proteinuria. So Shubhaditya, you can type in the answer if you are not audible. Within 30 seconds, you have to type in whether you stick with your previous answer or you want to change your answer. Okay, Shubhaditya says it's the same answer. That's what Shubhaditya has written. Okay, now it's time for revealing the answer. The answer is good pasture syndrome. It was discovered by good pasture, and the epidemiological information is about good pasture syndrome. It is the only syndrome where there is nephritic manifestation due to hemorrhage, but because of extensive damage to basement membrane, there is also nephrotic range proteinuria. So the answer good pasture is correct, and you get you have got 2 of them correct. So you get 10 for this, because you got it from the second level onwards. So you will get 10 for this. Your score is 10. Okay, The next question is to the fourth participant.
Sarvanan S.
Yes, sir.
Mr. Sarvanan S.
Yes, sir.
I'm a toxin that with vinegar once enjoyed a royal status. You can answer anyways because there's no negative marking. Let me know when the time is up.
Sir, time is up.
Okay, next clue. I can be treated with a course of Saximal.
Whether it's lead poison.
So is that your answer? Lead?
Yes, I fix lead for this. Lead poison.
Okay. Let's go to the next question and let's see whether you stick to your answer. My findings on your gums is eponymous with an eminent British physician and chemist.
Yes, sir. Lead poisoning.
So you think it's lead poisoning, and yes, the answer is lead poisoning. You get 20 for this. Lead oxide with vinegar. This paste was very popularly used by Queen Elizabeth for the makeup that she wore, and that was notoriously known to change her personality, her temperament, etc. Then Saximar is actually a succinic acid conjugate of dimercaprol, widely used in lead poisoning. And Burton's line or Burtonian line is after the name of Sir Burton, who is a British physician and chemist. And that is the line you get on the gums. So very good. You get 10 for this, not 20. You get 10 for this for attempting 2 questions correctly. We move on to our next participant.
Next
So
participant
this should be a
is,
third participant.
Yes, sir. Mr.
Yes.
Mr. Ayan Agarwal.
Yes, sir.
Ayan, I am an unicellular pathogen whose generic and specific names have the same meaning. I'm not saying they're the same word. They have the same meaning.
Sir, time is over.
Okay, next clue. I can live as a commensal or attack as an opportunist and have various applications in genetic engineering.
Sir, E. coli.
So do you think Escherichia and coli mean the same thing? Okay, you can stick to an answer, doesn't matter because there is no negative marking, or you can keep on trying. I'll only take the last answer that you gave in the time span.
Sir, time is over.
Okay, last clue. See if this helps you. I can assume more than one phenotype and used as a model organism for fungal pathogens.
So, Candida albicans.
So that's your final answer?
Yes, sir.
I'll lock it.
Yes, sir.
Okay, fine. So the answer is locked. Now it's the time for revealing the answer. Yes, your answer is correct. And you get 5 points for this. See, candida means white and albicans also means white. So candida albicans is a kind of a tautonym where the same thing is said twice. So, and also the rest of the points definitely relate to candida albicans. So the answer is candida albicans. Very good. Well done. So you get 5 points for this. Now next direct question will go to
Mr. Tamal Adhikari.
Tamal. So Tamal, this is your question. Make sure you unmute yourself.
Yes.
I am a clinical sign named after a Russian physician who trained and worked in the Russian Empire in the early 1900s. You can always ask for the next clue.
Yes, the next clue.
I am sometimes classified into direct and indirect.
Sir, is this Nikolsky sign?
Time is over.
Nikolsky sign.
So you have to stick to this then because time is over. Let's see if you agree with this in the next point. So this is how the sign is demonstrated. This is how the sign is demonstrated. Will you stick to your point or would you like to change your point?
Yes, stick to it. Stick to it.
Okay, it's time to reveal the answer. Wonderful. This is Nikolsky sign. And Nikolsky sign is the sign of Steven-Johnson syndrome or toxic epidermal necrolysis, where there are two ways of doing this, the direct and the indirect method. In the direct method, pressure causes a new blister to appear. In the indirect method, rubbing the hand the way it is shown here exposes the underlying skin. So this is Nikolsky sign. Very good. You get 10 points for this, for cracking 2 of the questions.
Thank you, sir.
So we are left with the first participant.
Yes, Ms. Swapna Sarangvi.
Yes, sir.
Yes, Swapna, this is your question. I am a microbe who can shrink your viscera in 10 years. You can always make a guess. There is no negative marking.
So next hint.
Okay. Although not related, I am treated using some drugs also used against HIV.
So hepatitis virus.
There is nothing called hepatitis virus. There is hepatitis A, B, C, D, E.
Okay.
So if you go for hepatitis, then you have to name which virus you want to talk about.
So hepatitis B.
Okay, you're going with hepatitis B. So shall I lock this answer at this point?
Yes, sir.
Okay, see the last clue and decide if you want to stick to your diagnosis. Hey, did I tell you that my father received his Nobel Prize this week?
So hepatitis B.
So that's confirmed. That's your final answer.
So hepatitis. Sir, I want to change.
What do you want to change?
Hepatitis C.
Why do you think it's C?
So because A and C got the Nobel Prize for.
So tell me the answer that you want to stick to, that whatever you say last is your final answer.
Time.
Time is going to be up. Just mention between A to E. What do you want to say?
Said B, hepatitis B.
So you're sticking with hepatitis B. Unfortunately, that's the wrong answer. It's hepatitis C. Now, how do you remember this? It doesn't matter because hepatitis B was a very close shot. It causes cirrhosis. It is also treated using retrovirals, but it did not receive the Nobel Prize. That was not the clue. Actually, there was a clue in the first point only. There is a dictum that from the point of diagnosis to the point of cirrhosis, the median time in hepatitis C is 10 years. This is about 25 years in hepatitis B. So it is almost given that within 10 years of contracting hepatitis C, unless treated, you will always develop cirrhosis. So that was the first clue. Second clue, of course, because lamivudine is used to treat hepatitis C as well. They are not related. Both are RNA virus, but hepatitis C is not a retrovirus. And also hepatitis C discovery received the Nobel Prize. So at the end of the second round, so can we know from the organizers, how do the scores look like?
Can we have the scoreboard, please? Okay, we have some time, like our organizer is tabulating the mark sheet. So, sir, I would ask to like your question. To ask your question.
Sure.
Sir, during the pandemic, how are medical students facing difficulty, and like, what are your views on this pandemic going on?
This is a very unusual situation that we are going through. I have been telling this many times that this is something that has not happened in the last 100 years. So all of us, irrespective of our age and experience, we are all facing it for the first time. So this is probably what a collective catastrophe looks like, something that affects everyone, irrespective of age, sex, race, creed. But then also, you know that not everyone can attune and adjust to a new normal in the same way. So stress builds up. And this is particularly true for students whose careers are in a jeopardy.
Yes, sir.
Also, the social relationships have become zero. I find people getting more irritable with time. Their patience is being lost. They are developing apathy to things that they used to like before. Like people who used to like watching films, they are not watching Netflix now. People who used to do whatever they like, I mean, those likings are gradually dying out. People are delving into a form of melancholy. So it's a very difficult situation. I think one thing that we can do to help each other is try to be compassionate, understand that if you are feeling irritable, other people are also feeling irritable. So it's not that they want to hurt you. They are themselves hurt in this situation. Understand that not everyone is equally privileged. So the kind of advantages that we can have, staying at home, being at least in some security of food, shelter, etc. Not everyone has the luxury to do that. So it's really a difficult time, a new challenging time when we are learning new life skills. I'm sure we'll get over this, and this will be a big learning lesson for all of us.
Sir, it's affecting the medical students' career as well, because without the clinical practice and skills, we are nothing. Because it's very important to learn the clinical skill and the practical skills required for the
Very true. The clinical skills have to be learned in the bedside only. They cannot be taught online.
Yes,
but at the same time, what I always felt is like the way we have looked at academics through the last 100 years. Am I audible?
Yes, sir. Yes, sir, you're audible.
So over the last few years, the way we have looked at academics, you know, that is a very colonial kind of academics, where the academics is designed to create skilled laborers. You will not find this kind of an academic in the Western countries. In the Western countries, you can leave a semester when you want. You can rejoin it when you want. Your degree stays with you. So the stress of completing things in a given amount of time, which we consider normal, I personally believe is not a very normal way of looking at education. Even if without this pandemic, suppose someone can have a family issue. So someone can opt for appearing at an examination 6 months later. That does not mean throughout the life the person has to carry a supplementary certificate. So life is different for everyone, and everyone should be given a fair chance. It is true that the clinical learning are getting affected, deeply affected, but it's also important that we are learning new skills. Who knew that we will be holding, say, a conference or a competition solely from the handheld devices one day? So we are learning new skills, and that is also one way of communicating and learning. And I'm sure that very soon the colleges will arrange for the classes to be held properly at the bedside, maintaining all protocols, and the clinical skills will also be learned. But do not hurry, do not do something in a haste that can put you at the risk of an infection. Because it's not only about you. You are young, and I'm very sure that if you accidentally get infected, you will recover. But there will be many people surrounding you who are old. And if they catch this infection, which is so unknown to us, the effects can be disastrous. So stay at home until the management or the government decides that the schools should open, and prepare yourself with all the kinds of knowledge and technologies that you have at hand. But do not just jump and rush to the words. This is my request to all of you.
Thank you, sir, for the suggestions. So we have the scoreboard now. After the round 2, so the scoreboard says Swapna Sarangi 0 points. Second is Tamal Adhikari with 10 points. Third is Mr. Ryan Agarwal with 15 points. Fourth is Mr. Sarvanan S with 10 points. Fifth is Shubhaditya Basu with 10 points. And last is Miss Tanisha Sanganeria with 0 points. So all the best for the third round to all the participants. Now I hand it over to sir.
In the third round, see, this third round is going to be a deciding round for sure. And in this third round, we are going to have questions again in 3 parts, but these are clinical questions. Now, looking at the scoreboard, what I felt is like this. Many of you probably are a bit panicked. You are thinking of rare causes and rare diseases. So please understand that the questions have been set keeping in mind that you are in the second or in the third year. So the questions are from the chapters that you have studied. Just for example, you see, you were thinking of big diagnosis like ulcerative colitis, while the diagnosis could have been amoebic dysentery. So think of simple things first, because the simple things can have very unusual presentation. So the questions have not been deliberately made difficult. So think of easy options first, come up with them. In this round, there is a negative marking, just to make the thing more challenging and interesting. So every question comes in 3 parts, just like the previous one. Only that here each part is 1 slide. Each part is not 1 line. So that can be an image, that can be a clinical information, that can be a small history, or that can be an animation that tells you something about the patient. You have the possibility of guessing the diagnosis at that point. If you cannot, you move on to the next round. Then again, if you cannot, you move on to the next round. Now, how will you be scored? If you give the right answer, in the first go, you get plus 30. Second go, you get plus 20. Third go, provided you stick to the end, then you get plus 10. If you give no answer, then you get 0. But if you give the wrong answer and stick to it till the end, from the first, you get minus 30. If you give a wrong answer and stick to it till the end, you get minus 20. Similarly, minus 10. But you have an option. In the last point, if you think you are wrong, you can always say, I dismiss my answer. I'll not hold on to my answer. But then that way, if it is correct, you get 0. If it is wrong, you also get 0. But your negative marking will be gone. So if you think at the last moment that you are horribly wrong somewhere, but you don't know the answer, but you are sure you are wrong, then at least you have the option of withdrawing the answer and not having a negative marking. But if you stick to the answer, either you will be getting full marks for that or equal amount of negative marks for that. And every question here, every piece of the question will be for 40 seconds. So you have 40 seconds to go through that and give your answer. Am I clear to everyone? Can we start? Now this time what we will do is, since this is the deciding round, so I don't want to decide who is going to take up which question. I initially thought there will be a ranking by now, based on which we can select. But since that's not there, I will be randomly asking people to allot themselves some numbers. So can you do one thing? Can all of you access the chat box? The participants? Is the chat box open to everyone?
Yes, sir.
Okay. All of you, please write yes in the chat box so that I know that there is no delay in your communication. Okay. Now, all 6 of you simultaneously choose any number from 50 to 200 and write that number now. Any number. You don't have to know the significance of that. Any number that you choose, just write it down. So do we have all the 6 numbers? We have. Fine. So these are random numbers chosen by you. And based on this number, we will now develop an ascending order. So Shubhaditto, you have the smallest number. So Shubhaditto, for this particular round, you will get question number 1. The second in order, help me if you can see, I think is from Shopna. Shopna has picked up 100. Shopna, your question number will be 2. The third is Saravanan, your serial number will be 4. Tanisha, you are 3. Did I include Tomal? No, I forgot, right? So let me go again. So I'm typing out the participants. So Shubhaditto, you are 1. At the second question will go to Shopna. The third question will go to Tomal. The fourth question will go to Tanisha, I think. Yes. The fifth question will go to Paravanan. And the sixth question will go to Oyon.
Sir, before beginning, I wanted to reconfirm that every question is for 40 seconds, right?
Yes, every question is for 40 seconds.
Okay, sir.
You can move on to the next question earlier if you wish, but that doesn't give you more time for the next question. Fine. So here comes the first question for Shubhaditto. So those who are keeping the score, this is for Shubhaditto. So Shubhaditto, this is your direct question. Make sure that you are unmuted because you have 40 seconds of time. I can see you are muted. Okay. Your time will start after I stop reading. A 52-year-old male presented to the outpatient department with extreme weakness and fatigue. His relatives informed that he was speaking meaningless jargons for the last 1 day. He is under treatment for depression, diabetes, hypertension, and dyslipidemia for the past 3 years. On examination, his blood pressure was 90/70, pulse was 92 per minute, and pupils were slightly constricted. Your time starts now. Can you make any guess? So what is the condition that is causing the weakness, the fatigue, and speaking meaningless jargons? Shubhaditto, you have written something. Warnix aphasia. Shubhaditto has written to me warnix aphasia. Okay, so your answer is warnix aphasia. Let's go to the second part, and you can decide whether you will stick to it, change it, or withdraw all answers. So these are the reports. Your time will start after I end reading. His complete hemogram revealed mild anemia. Serum creatinine was 1.7, serum sodium 131, serum potassium 5.9, blood glucose 450. So these are available. And then something was also ordered. So we ordered for arterial blood gas analysis, chest X-ray, ECG, and urine analysis. Your time starts now. Shubhaditya has written diabetic ketoacidosis. So taking this as your answer right now, I'll go to the third part of the answer, which is the last part. So you can stick to your answer, change the answer, or withdraw the answer. Arterial blood gas report showed PO2 95 millimeter of mercury, PCO2 38 millimeter of mercury, bicarbonate 23 milliequivalent per liter, pH 7.36, anion gap 16 milliequivalent per liter. And these are the pictures showing the Benedict test finding and the Rotheras test finding. Your time starts now. Will you stick to diabetic ketoacidosis or change your diagnosis or withdraw the diagnosis? Okay, you will stick to it. So I'm locking the answer, right? Okay, fine. So Shubhaditya has locked the answer to diabetic ketoacidosis. Now, because the answer is now confirmed, before I reveal whether it is correct or not, it's a question to the participants. Participants, do you have any guess if Shubhaditya has been correct or not? You can openly answer, that's not a problem, although you'll not get any points if you're right or if he is wrong. Is there any participant who disagrees with Shubhaditya and wants to give a different answer? Or is there someone who strongly agrees with Shubhaditya and thinks it is diabetic ketoacidosis? Everyone? Okay. Now, Shubhaditya, it was wonderfully tried, but the answer is wrong. Because you stuck to the answer from the second point, so you will get -20 for this. I'm explaining the answer from the beginning as to how you could deduce the answer. Now, DKA was a close diagnosis. That is why I congratulate you. It was not an easy question. 52-year-old male is getting treated for diabetes for past 3 years. That means we are not dealing with type 1 diabetes. We are probably dealing with a type 2 diabetes. Now, DKA is relatively uncommon in type 2 diabetes. Also, the patient has other features of metabolic syndrome like dyslipidemia, hypertension, again pointing towards a type 2 diabetes kind of phenomenon. When the patient presented to you, the patient was in a hemodynamic shock. BP was very low and pulse was very high. Slightly constricted pupil indicates sympathetic overactivity. Now, in this condition, it can be diabetic ketoacidosis, although it's relatively uncommon in a case of type 2 diabetes, or it can be lactic acidosis or hyperosmotic non-ketotic coma. So in the next phase, we see serum sodium is low, which happens in osmotic diuresis. Serum potassium is high. In both DKA and honk coma, the serum potassium tends to be high before therapy. So here also DKA stands. But the blood glucose is 450. Again, 250 above can be DKA. Honk coma usually has a value of 350 or 400 above. Now, in the last step, you see that the Rotheras test is negative, but urine sugar test is strongly positive. There is no dark purple ring at the junction of the two fluid. Also, the pH is 7.36, which is normal. Normal pH is 7.35 to 7.45. So there is no acidosis. Anion gap is normal. So there is no unexplained anion. So we are probably dealing with hyperosmotic non-ketotic coma, neither lactic acidosis nor diabetic ketoacidosis. So the answer is hyperosmotic non-ketotic coma. I hope it is clear to you. Okay, fine. So I'm asking the organizers who is going to get the second question. I think Shopna, right? So Shopna, the second case goes out to you. Shopna, make sure that you are unmuted.
Yes, sir.
So this is your case. A 49-year-old male presents with recurrent attacks of tremor and unconsciousness. On examination, he had acromegalic feature and multiple skin tag. He is non-diabetic, normotensive. Examination revealed a mass in the abdomen. He was suggested some blood test and CT scan of chest and abdomen. So your time starts now.
Sir, men too.
That is too big a diagnosis because men is not actually one diagnosis, that's multiple tumor diagnosis. But you can make a syndromic diagnosis if you think those tumors are present. So you think this is MEN2. You will stick to that?
Yes, sir.
Okay. Check this and see if you decide to be with that. The blood sugar level during the attack of tremor and fainting that he was having was 40 milligram per deciliter. Plasma insulin and C-peptide level were low. CT scan revealed a retroperitoneal mass and biopsy from the mass looked like this, as in the picture. Try to think, there is no need to stress out. This is not an examination. Low sugar, but low insulin, low C-peptide, and retroperitoneal mass. That looks like this.
The time is up.
Okay. So by default, we have to go to the next question. Next set of the question. Check if you would like to stick to a MEN2 or make a new diagnosis or withdraw the diagnosis. His plasma insulin-like growth factor activity was high. The mass was removed by surgery. He was followed up with chemo and radiotherapy.
So can we go to the first slide now or not?
You can go, but means the sequence of answer is there. You have already chosen MEN2 in first slide. That will not change. But for reference, of course, you can go back and read the question. That's not a problem.
So the time is up.
Time is up. Any last answer that you have, or I'll close the question? Okay, question closed. So it's open to the participants now. Anyone who wishes to try can try. There's no harm in trying. Anyone? Saravanan, Ayan, Tanisha, Tomal, Shubhaditto. Anyone who wants to try can try.
So is this Zollinger-Ellison syndrome?
No, you're close to it, but it's not. So I'm explaining the answer one by one. See, it is a very easy question, but you have to look at it in this way. It's a 49-year-old male who presented with tremor and unconsciousness. There can be many reasons of tremor and unconsciousness. Also, there was acromegaly-like features and skin tag. These are effects of either growth hormone or insulin-like growth factor. We do not know which one is responsible here. Also, he is non-diabetic and normotensive. So hypoglycemia due to drug use is not a situation here. And there is a mass in the abdomen. This is a very strong clue to this. So are we thinking of a tumor that secretes insulin or insulin-like substance? Now, if there is a tumor like a beta cell tumor, which is an insulinoma, then it will secrete insulin. So plasma insulin level and C-peptide level must be very high, and that is causing the hypoglycemia. But here that is not the case. Then probably we are not dealing with an insulin secreting tumor. We are dealing with a tumor secreting insulin-like growth factor or insulin-like peptides. Now think in this way, which tumor will secrete an insulin-like peptide? No tumor normally does. Then are we dealing with a paraneoplastic syndrome? So under endocrine paraneoplastic syndrome, there is one important category, one group of tumor that secretes insulin-like polypeptide. That is retroperitoneal sarcoma or retroperitoneal fibrosarcoma. You can see elongated spindle-shaped cells filling up the whole thing. This is sarcoma histology, and retroperitoneal was mentioned in the slide. And to make things more confirmatory, the IGF level was measured and it was high. It was removed by surgery followed by chemoradiotherapy, indicating it's a malignant tumor. So it's a sarcoma. So solid retroperitoneal sarcomas often secrete insulin-like growth factor that causes both growth hormone-like activity as well as hypoglycemic activity. Okay, fine. Good. So next direct question will go to Tomal. Tomal, make sure you are unmuted.
Sir, what will be the score given to second participant? Second participant for this participant.
This participant. See, you did not change your diagnosis, and you made your diagnosis as MEN2 in the beginning. So you will get -30 for this, unfortunately. And I'm telling all participants, you have the option of withdrawing the answer at every point of time if you are not sure. Let's see. This is your question, Tomal. A 27-year-old man underwent a routine evaluation before joining his job. The investigations revealed normal hemoglobin, normal chest X-ray, normal ECG. His liver function test revealed bilirubin level of 2.5 milligram per deciliter. Conjugated was 0.3, unconjugated was 2.2. However, AST and ALT were both normal. So because of this high bilirubin level, he was advised a complete hemogram, reticulocyte count, hepatitis serology, and ultrasonography of abdomen. At this point, do you have a diagnosis?
Sir, I choose Gilbert syndrome.
Okay, you think this is Gilbert syndrome. We'll go to the next slide then. You check whether you will stick to it or change your diagnosis.
Yes.
Complete hemogram revealed normal hemoglobin, RBC indices, and peripheral smear. Reticulocyte count was 0.8%. Hepatitis serology was negative. Ultrasonography abdomen was within normal limits. So will you stick to Gilbert syndrome or change your diagnosis or withdraw your diagnosis?
Sir, we'll stick to it for this.
Sure?
Yes, sir.
Okay. Moving on to the third part, see if you would like to stick to it or change it. He was advised to avoid certain drugs in future, but there was no medication or special diet prescribed. So what's your diagnosis now? Your time will be up. You can stick to the diagnosis, you can change it, or you can withdraw the answer.
So sticking to it.
Okay. So should I lock this answer now?
Yes.
Okay. So what do the other participants think? What will be the answer to this case?
G6PD deficiency.
What do others think? Shopna thinks it can be G6PD deficiency. Any other opinion from other participants? So congratulations, Tomal. This is Gilbert syndrome and you get plus 30 for this. The clues were there from the beginning. The 27-year-old man underwent a routine evaluation before joining the job. That means there is no symptom. The patient was actually not a patient. The subject was asymptomatic. And what we are finding here is an important category in hepatology. It's called isolated elevation of bilirubin. Only bilirubin is elevated, no other enzyme is elevated. An isolated elevation of bilirubin typically occurs in case of some congenital disorder or hemolytic anemia. Now, if the CBC and reticulocyte count are normal, then obviously hemolytic anemia has been ruled out. We are left with Crigler-Najjar syndrome, Gilbert syndrome, Rotor syndrome, and Dubin-Johnson syndrome. Now, out of this, Crigler-Najjar produces severe symptom. So this is not that case. Rotor and Dubin-Johnson produces conjugated hyperbilirubinemia. So this is not the case. So you are left with Gilbert, which is unconjugated, asymptomatic, and no treatment is needed for Gilbert syndrome. Only those drugs which are metabolized by UDP glucuronidase transferase have to be avoided. So very good. It was very well done, Tomal. So the next question will go to Tanisha. So Tanisha, make sure that you are unmuted. So here you will get plus 30, Tomal. Okay, Tanisha. So this is your question. A 27-year-old doctor presented with high fever, maculopapular rash, and generalized lymphadenopathy. On examination, there was mild hepatosplenomegaly. Complete hemogram revealed raised mononuclear cells. So a number of differential diagnoses were thought. So we did a lot of tests. All test reports were negative. Monospot test negative, HIV ELISA negative, dengue NS1 negative, Widal test negative. At this point, do you have a diagnosis?
So can we pass to the next clue?
Sure, sure. She complained of a recent needle stick injury in the labor room, which went uncared for. So she was tested for hepatitis serology and asked to repeat all tests after 3 and 6 weeks. Now the immediate hepatitis serology, that is hepatitis B, C, etc., they were all negative.
Right, don't know. Can we?
Okay, so I'm passing over to the last clue. See if you can answer this. On follow-up, her HIV ELISA after 6th week became positive. She was advised to do a Western blot test and visit the anti-retroviral therapy advisory team. So what was the initial condition? This finding we know now. What was the first condition that she was suffering from?
Lymphadenopathy was there, hepatosplenomegaly, and maculopapular rash.
You will be only scored for the third question though. So this was the question.
I'm actually blanked out.
Okay, fine. So is there anyone who would like to try? This round is difficult. I should admit this is difficult at your standard. Anyone, any of the participants would like to try? When a person
is it human T-cell lymphoma?
No, it is not. It is not.
I'll withdraw that.
Okay. Okay, fine. So you get 0 for this. No negative marking, no positive marking. Now, I'm explaining this answer to you. The diagnosis of this condition is very typical. So if you have read about this, you will always identify this condition. This condition is called acute retroviral syndrome or seroconversion illness. When a person becomes HIV positive, within days to weeks after being positive, the T lymphocyte starts fighting with the virus, and there is a storm of cytokine. This causes skin rashes, high fever, and lymph node enlargement. And it mimics infectious mononucleosis. That is why the rule of thumb in dermatology or in infectious disease medicine is, if you think acute retroviral syndrome, rule out mononucleosis. If you think mononucleosis, rule out acute retroviral syndrome. So they ruled out by monospot test, that is for mononucleosis, that was negative. HIV will be negative because ELISA is antibody-based test. It is still within the window period. If instead they would have done a P24 antigen assay, then that antigen assay would have come to be positive. But they have chosen the ELISA method. ELISA will always be negative for this. Dengue and Weedle definitely are negative. Hepatitis will be negative. After 6th week, when the antibody production starts, the window period is over, then the ELISA becomes positive. And so we need a more confirmatory test like Western blot to confirm the diagnosis. So this was seroconversion illness or acute retroviral syndrome. That one was your. Okay.
Thank you, sir.
So the next question will go directly to Saravanan. Saravanan, I unmute it.
Yes, sir.
Okay. I'll give you time to read this. A 52-year-old man was brought to the psychiatry outpatient department with complaints that his dead wife stares at him from the corner of the bed every night. He also complains of little people running around the house. The family members added that he has a disturbed sleep and often becomes very absent-minded or zoned out. Physical examination was normal, except mild resting tremor. And CT scan of the brain done a few months back revealed no cerebrovascular accident, no space-occupying lesion, no traumatic lesion. So at this point, do we have a diagnosis? Your time starts now.
Whether it's a Lilliputian hallucination, cocaine.
No, that is the name of the hallucination, but what is the disease?
Cocaine.
That is already given here. I mean, this Lilliputian hallucination has been totally described here. But I'm not asking about the symptom. I'm asking about the disease. Like, I'm just giving an example. I'm not saying that is the answer. Suppose paranoid hallucination is the symptom.
Alice in Wonderland.
Schizophrenia is the disease. So what is the disease here?
Alice in Wonderland syndrome.
Okay, we'll stick to Alice in Wonderland syndrome?
Yes, sir. I will stick to.
Okay. Read the second part and see if you'd like to stick to that or change that or withdraw. He was prescribed low-dose haloperidol oral drops by a junior resident doctor. However, within 24 hours, he was rushed to the emergency with dystonia. It subsided after administering promethazine injection. Mind you, he was given low-dose haloperidol, not high dose. And I'm asking for the diagnosis of the first slide.
Whether I can change neuroleptic syndrome.
No. This is, see, you are misunderstanding the question. I'll give you time to understand this.
Yes.
The disorder that the patient is suffering from is the first paragraph.
Oh.
Now, the same patient also develops this. This is definitely extrapyramidal side effect. That's fine. That is not the diagnosis. What is the diagnosis that causes extrapyramidal side effect with low dose haloperidol, not high dose? You got my question? This is actually a clue.
Sure.
So you can stick to Alice in Wonderland syndrome. You can add a new diagnosis or you can withdraw your diagnosis.
Delirium tremens.
Okay, you'll stick to delirium tremens. Let me go for the next one. Now see if you would like to stick to it or change it. He was admitted and examined by the senior faculty member. His cranial nerve examination revealed hyposmia, that is lack of smell sensation, and dysphagia, difficulty to deglutition. His polysomnogram revealed REM sleep disorder. Dopamine transporter uptake in brain was low as shown by positron emission tomography. Radioiodine labeled MIBG myocardial scintigraphy revealed low uptake. So do we have a diagnosis now? I actually given you all the diagnostic criteria. You can stick to your diagnosis, change it or withdraw it.
I will discuss Parkinson.
So your diagnosis is Parkinson. You want to stick to Parkinson's?
I will discard Parkinson. So okay, Parkinson. I will. If it is wrong means how many negative I will get? Parkinson.
-10. If it is wrong, if you will get +10 if it is right.
So the time is up.
So what's your final
Parkinson.
answer? Parkinson. Okay. So now let me come to the answer. Let's go step by step into this. So we are talking now, Saravanan, you actually analyzed the symptoms wonderfully. Just you had to put them together. Now, this is an old man. The disorder has an onset around 50s, not 60 or 70. So we are probably not dealing with classical Alzheimer disease. Alzheimer has an onset around 65. This is a much early onset kind of disease. The old man is having visual hallucination. Now we have one important saying, visual hallucinations are common in organic brain disease and auditory hallucination are more common in schizophrenia. So this is probably an organic brain disease that we are dealing with. Now, the family members said that the person becomes extremely absent-minded. And there was mild resting tremor, which is a mild Parkinsonian feature. But classical Parkinsonian features were not seen. Also, there was no specific damage shown in the brain. When you get partial Parkinsonian features with features of absent-mindedness, dementia, and visual hallucination, added to this, this is a criteria, excessive sensitivity to first-generation antipsychotics. A drop of the antipsychotic causes dystonia or neuroleptic malignant syndrome. Added to this, there is abnormal REM sleep behavior and reduced dopamine transmitter activity. These are all criteria of a very Parkinson-related disorder. Only difference is, instead of the basal ganglia, it affects the whole brain. It is called Lewy body dementia or dementia with Lewy body. Visual hallucination, sleep disorder, and the features like hyposmia and dysphagia are classical of this disorder. Also important is the sympathetic nerves degenerate in the disorder. MIBG is a guanidine derivative, which is taken up by sympathetic neuron. Its less uptake means there is sympathetic degeneration. So all these features suggest that we are dealing with dementia with Lewy bodies. Okay, fine. So you get -10 for this.
So what is the cause for hyposmia and dysphagia in Lewy body?
This is not clearly understood, probably because in the insular cortex, where the smell sensation is analyzed, there is also Lewy body deposition and destruction. So now the next question, the direct question and the last of the round will go to Ayon. Ayon, are you ready?
Yes, sir.
Okay. This cannot be. There were 6 cases. Just a minute. There could have been a problem with the PowerPoint. I'm getting your question back. No problem. We'll start shortly.
While sir is
have the question. There was a technical glitch. Just a minute.
While sir is solving the technical issue, I remind you that out of 6 participants, there will be 3 winners, first, second, and third winners. The first winner will get the 6 months Marrow subscription. The third winner will, the second winner will get the 3 months Marrow subscription, and the third winner will get 2 months Marrow subscription. Thank you and all the best.
Okay, we have got the case. Thank you for waiting. So this is your question. A 40-year-old male presented with progressive weakness and pain in abdomen. On examination, his scrotal sac was empty, but the penis was normally developed. He complained that his scrotum has been empty since birth. An inquisitive urine test for pregnancy was found to be positive. Do we have a diagnosis here?
So next clue.
Okay. Examination of the neck during general survey revealed mild diffuse goiter. His pulse rate was 98 per minute and skin was warm. Fingers showed fine tremor. I mean, this is a very easy question. I mean, it's not a rare thing I'm talking of. You think you will get the answer. Something very common I'm talking about. Empty scrotum, positive urine test, diffuse goiter, skin warm, pulse 98, fine tremor. Do we have time?
So the time is up.
Okay. So let's go to the third clue and see if you can come to some diagnosis. He underwent laparoscopic biopsy. The biopsy looked like this under microscope. Chest X-ray was normal. This is the biopsy of the laparoscopic specimen. So do we have any answer?
No, sir.
So the time is up.
Okay, fine. So can anyone attempt this question? Would someone like to try?
So from the YouTube live, Pratibha Modi has answered a seminoma. Shoyukta Mujumdar has answered seminoma. Amazing Andali has answered Cholangiocarcinoma of undescended testes. And lastly, Pratibha Modi has again answered seminoma, lymphotic infiltration in septa.
So this is seminoma, but see how the case stands here. The 40-year-old male said that the scrotal sac was empty from birth. That means we are dealing with undescended testis or cryptorchidism. Now tell me, what is the most common complication of undescended testis? What happens when the testis is undescended? What happens to the testis? It usually undergoes malignant change because of the higher temperature of the abdomen. That is why all undescended testes should be operated. So it underwent a malignant change. So let us assume that the malignant change that it underwent is a testicular tumor. A common testicular tumor is seminoma, that is the commonest actually. And it usually secretes alpha fetoprotein and human chorionic gonadotropin as tumor markers. Because the tumor secretes HCG, so the urine test will be positive. And because this is very interesting, you will remember that we always measure beta HCG, not alpha HCG. These polypeptide hormones have alpha and beta subunit. The alpha subunit belongs to a common family of protein that is shared by many hormones like FSH, LH, TSH, and HCG. They're very similar. That is why HCG can falsely end up stimulating the thyroid gland, causing goiter, also explaining why pregnancy causes goiter. So the goiter was also a manifestation of increased human chorionic gonadotropin. That is why the pulse rate was high, skin was warm, and fingers showed fine tremor. And this is the classical picture of classic seminoma of cells that are pale and clear with vesicular nuclei, and the septa are infiltrated with lymphocytes. So this is the seminomatous or malignant transformation of an undescended testis, which is now releasing HCG and is causing other manifestations. Okay, fine. So those were the questions. So can we see the scoreboard once?
Yes, sir. Now we are almost at the end of the session. So I would like sir to give his closing remark and then we'll move towards the scoreboard. Sir, please.
Yeah, this has been a very nice experience. But I'm sure that you must have at least enjoyed the session. I tried to keep the questions as simple as possible, but I'm not sure whether I could do that properly. Now, I will also ask the participants to share their view on what they think about how the session went, where we could have improved, or how you did. I personally found all of you thinking very hard, thinking very rationally. And that is all about it. I mean, this is at the end of the day a game. This is not an examination. That's what I always say. So this is something that has to be enjoyed. And all of your scores in the prelims have been wonderful. So I've seen the prelims results, and all of you did wonderful in the prelims. Here also, there has been a very tough competition, you see. So we have Saravanan, you had your bad luck of having a negative marking. Tanisha, you were playing very safe. And Shubhaditya, you played hard, and good that you did not play safe. You participated wholeheartedly. Same stands also for Shopna. At least you participated wholeheartedly. And so the competition now stays between Tomal and Oyun. So Tomal, Oyun, you become the second highest with 15 points. Tomal, you scored the highest point with 40 points. So these are the results, and congratulations to everyone for participating, for being there, and for being part of this event. Over to the organizer.
Actually, since we have a tie-up for the third position, but we can only choose one. So what to do, like how to go ahead?
So we can go, either you can award the prize to both of them because they actually tried hard. They attempted at least something. And second is you can go with a tiebreaker if you have only one prize to share. Otherwise, you can give two prizes, whatever is convenient at the organizer end. You tell me what to do.
I think so we should go for a tiebreaker because...
Okay, fine. So we will go for a tiebreaker between participant number 4 and 6. So Saravanan and Tanisha, are you ready? Unmute yourselves.
Yes, sir.
Yes, sir.
So this should be fun. I have to think of a question now. I'll ask a question to both of you.
Yes, sir.
Anyone who raises the hand first answers, but that's not the point. Now, anyone who raises the hand first answers, and if the answer is correct, the person wins. If the answer is wrong, the other person, even without attempting, automatically wins.
So how to raise the hand, whether it's visible like this?
Yes, you will just raise your hand, not the raising hand option. You because I can see both of you, and there is no lag in time. So
Yes, sir.
I'll just ask both of you. I want to make this very fair to both of you. This is a second year thing. So out of the 4 subjects, pathology, pharmacology, microbiology, and forensic medicine, choose any 2 subjects.
Pathology.
Pharmacology.
2 each. Tanisha, you
Microbiology and pharmacology. Microbiology and pharmacology.
You said
Sir,
microbiology and pharmacology. Tanisha?
Sir, pathology and microbiology.
Microbiology is common between the 2. That is what I wanted. So I want to choose a subject that both of you are comfortable with. So I'll ask a question on microbiology then. Fine? Okay. So what should I ask you to break the time? Fine. Answer this question. What are, or give one example, not what are, I'll not ask a definition for a tiebreaker. Give one example of a pattern recognizing receptor. Okay. So Tanisha, you raised the hand first. So if you are wrong, then by default, Saravanan wins.
Sir,
if you're right,
sir,
yes.
I have to tell the receptor, right?
You have to name the receptor, the pattern recognizing receptor.
Sir, TLR4, toll-like receptor.
What pattern does it recognize?
So lipopolysaccharides.
Okay, fine. So this is the right answer, unfortunately for Saravanan. So yes. So Tanisha, you broke the tie. So this is a pattern recognizing receptor. I'm really feeling bad for Saravanan because you went all this way. Doesn't matter because I will consider both of you as winners in the 3rd position. But we had to break the tie. There was nothing doing. So congratulations to all of you for participating. Over to the organizers.
Yes, congratulations everyone, and thank you, sir, for conducting such a wonderful quiz, and it was very interesting. Thank you, and congratulations to the 1st, 2nd, and 3rd winner. I'd also like to mention that along with the Maro subscription, you get the Amazon gift cards as well. And now I request everyone to join in our valedictory ceremony, which is on 11th of October at 7 p.m. And would request sir also to join the valedictory ceremony if sir has time. So,
thank you.
Okay, and thank you, SAMSACON Organizing Committee, for hosting such a wonderful event. That's all from my side. Thank you. So that's all, and I guess we should end the meeting now. Thank you, sir, and thank you all the participants.